Title: Diabetes Explained in 5 Minutes. Causes, Types, and What Really Matters. Hook diabetes is not one disease. It is a system failure in how your body handles glucose, the fuel your cells need to survive. When that system breaks, sugar floods the bloodstream, silently damaging organs until it becomes dangerous. Core explanation: every time you eat carbohydrates, rice, pasta, bread, fruits, sweets, your body breaks them down into glucose. That glucose enters your blood and waits for one key: insulin. Insulin is a hormone made in the pancreas. Its job is simple: open the door of your cells so glucose can get inside and be used for energy. In a healthy body, this works perfectly. You eat, glucose rises, insulin responds, cells absorb the sugar, and blood levels return to normal. Type 1 diabetes. In type 1 diabetes, your immune system attacks your own pancreas and destroys the insulin-producing beta cells. No insulin means no key. Glucose cannot enter cells, so it stays in the blood at toxic levels. This type appears early, often before age 20. The symptoms come fast: extreme thirst, constant urination, fatigue, sudden weight loss, blurred vision, and slow healing wounds. Without treatment, it can turn life-threatening. Management requires insulin injections for life. That is why type 1 diabetics are insulin dependent. There is no lifestyle fix that replaces missing insulin. Type 2 diabetes. Type 2 is different. Insulin is present, sometimes even high, but the cells stop responding to it. The lock is broken. This is called insulin resistance. This form develops slowly, usually after age 30, and is strongly linked to lifestyle factors: excess body fat, poor diet, low physical activity, chronic stress, and disrupted sleep. Genetics load the gun, lifestyle pulls the trigger. It makes up 80–90% of all diabetes cases worldwide. Symptoms creep in quietly: numbness in hands and feet, persistent hunger, brain fog, recurring infections, dark patches on the skin, especially the neck and armpits, and constant tiredness. Management focuses on restoring insulin sensitivity through weight reduction, muscle building, and reducing glucose spikes most effectively through a low-carb diet. Increased movement and improved metabolic health. Gestational diabetes. There is also gestational diabetes, a temporary condition during pregnancy caused by hormonal changes that impair insulin action. It usually resolves after childbirth, but increases the mother's future risk of type 2 diabetes if metabolic health is not improved. The consequences: if ignored, uncontrolled diabetes destroys the body gradually. High blood sugar damages blood vessels and nerves. The major risks include heart disease, kidney failure, vision loss, stroke, and nerve damage that can lead to amputations. Diabetes does not kill quickly. It disables slowly. Prediabetes, the warning phase. Before type 2 diabetes fully develops, most people pass through prediabetes, elevated blood sugar that is higher than normal but not yet diabetic. This is the final window to reverse the trend. Many people in this stage feel nothing. That is why early testing matters more than waiting for symptoms. Practical takeaways: if you want to avoid or delay type 2 diabetes, reduce refined carbs and sugar. They spike glucose the hardest. Increase muscle mass. Muscle absorbs glucose better than fat does. Walk after meals, even 10 minutes cuts glucose spikes. Fixed sleep, poor sleep increases insulin resistance. Get tested fasting glucose and HbA1c. Expose the truth early. If you already have diabetes, understand this: medication manages the outcome. Lifestyle manages the cause. Close diabetes is ultimately a glucose and insulin disorder. Type 1 is a lack of insulin. Type 2 is a lack of response to insulin. Both end in high blood sugar. One requires lifelong insulin. The other requires lifelong metabolic discipline. The earlier you act, the less damage you inherit.